We have a tremendously talented group of people that work as part of our department. We have a really strong team. We can cover the gamut for people, whether it's something reconstructive or particular aesthetic procedures, from things that are non-surgical all the way up to the things that Dr. Mulkey and myself do.
I think we provide the same quality of care that you could get at any academic center or any major center anywhere else. Maybe a little bit more private, a little bit more personal contact than what you would get in a larger institution.
In terms of the cosmetic side of things, facial rejuvenation. So people that don't look the way they feel, again, they're a young 50 or a young 60, but on the outward side of things, they may look like they're 10 years older, and they've worked very hard to keep their health and fitness level, but their face or their appearance doesn't keep pace with that.
Blepharoplasties are probably the most common thing I do. In most blepharoplasties, there's a cosmetic component to it, but there's also a reconstructive component to it. Most of the people that have problems with their eyes have more than one problem. In order to get the best result on some of the eye surgeries, you need to be able to fix all the problems while you're there. A large part of my practice is breast cancer reconstruction or breast reductions and breast deformities. You can make a big impact in someone's life doing something like that.
Body recontouring. We have a lot of patients in our part of the country that have lost a lot of weight, and unfortunately their skin doesn't have the snapback that it used to. So recontouring the body to restore a more aesthetically pleasing shape is something I really enjoy doing too. Nature has its way of taking its toll on mothers worldwide, and so some mothers would like to look a little bit better in terms of how they may have felt before having children. And so in that respect, it's a lot of fun to be able to help a woman regain some self-confidence, perhaps, in terms of tucking this or nipping that to give them a figure that they had prior to children.
Plastic surgery, we do facial trauma, we do hand trauma, we do burns. I had a patient that had fallen and put her arm through a glass table, and she basically cut her arm, all the nerves of her arm, all the muscles of her arm. We felt it was reasonable to take her to the OR and try to salvage the arm. She works in a motel, and she's the person that runs the motel. She's able to do her vocation without any compromise whatsoever. If I can make someone's life better, that's what it's all about.